lungs are a pair of spongy, air-filled organs located either side of the chest. The windpipe conducts inhaled air into the lungs through its tubular branches called bronchi. The bronchi then divide into smaller and smaller branches. Finally, they become microscopic. These are called alveoli. The alveoli are an important part of the respiratory system whose function it is to exchange oxygen and carbon dioxide to and from the bloodstream. The process of breathing is divided into two distinct phases, inspiration and expiration. During inspiration, the diaphragm contracts and pulls downwards, whilst the muscles between the ribs contract and pull upwards. This increases the size of the chest cavity and decreases the pressure inside. As a result, air rushes in and fills the lungs. During expiration, the diaphragm relaxes and the volume of the chest cavity decreases, while the pressure within it increases. As a result, the lungs contract and air is forced out. Chronic obstructive pulmonary disease, otherwise known as COPD, describes a group of lung conditions that make it difficult to empty air out of the lungs because your airways have been narrowed. Two of these lung conditions are bronchitis. This means the airways are inflamed and narrowed, often producing sputum or phlegm, and emphysema. This is when the air sacs at the end of the airways break down, making the lungs baggy and full of holes which trap air. These narrow the airways, which make it harder to move air in and out. This means your lungs are less able to take in oxygen and get rid of carbon dioxide. Bronchiectasis is another long-term condition that can affect the airways in your lungs. When you breathe in, air is carried into your lungs through your airways called bronchi. The bronchi divide again and again into thousands of smaller airways called bronchioles. Your airways contain tiny glands that produce a small amount of mucus. Mucus helps to keep your airways moist and traps the dust and germs that you breathe in. The mucus is moved away by tiny hairs called cilia, which line your airways. If you have bronchiectasis, your airways are scarred and inflamed with thick mucus, also called phlegm or sputum. Your airways become widened and cannot clear themselves properly. Pulmonary fibrosis is another condition that can affect the way you breathe. In pulmonary fibrosis, you have scarring to your lung tissue. This reduces the efficiency of your breathing. This buildup of scar tissue is called fibrosis. Fibrosis causes the lungs to become stiffer and to lose their elasticity, so they're less able to inflate and take oxygen from the air you breathe.